Hi, I'm Rossana Cordon, the vet from Pistoia Zoo in Italy, and today I'm speaking about monitoring and treatment of lung parasites in red pandas and meerkats, a case study at Pistoia Zoo. Who are lung parasites? Are a widespread health issue in captive and wild mammals, and they cause heavy respiratory symptoms, enlargement of cardiac chambers, and death. The life cycle is simple. Mammals become infected through the ingestion of intermediate hosts, such as snails. The larvae in the final hosts are caught out and ingested and passed out in feces. The larvae in the environment are ingested by intermediate hosts, such as snails, and the intermediate host is ingested by the final host. For red pandas, some studies have been performed that have shown increase of the incidence of metastrongyloid infection in wild red pandas, and pneumonia is the most common cause of dead juvenile pandas in North America zoos, and 4 cases of severe verminous pneumonia associated with Angiostrongylus vasorum were reported in European zoos, and clinical and asymptomatic cases were found in European and American institutions. Our study was born because at Pistoia Zoo previously registered the death of one red panda due to ischemic brain stroke and lesions of heart, liver and lungs due to larva migration and adult stage parasites, and the death of 2 meerkats due to heavy lung parasitosis. Respiratory symptoms are a prominent manifestation of lung parasites, but were not found in the dead red panda. We investigated the presence of lung parasites in both species to define an ad hoc treatment. There were 2 challenges: the eradication of the intermediate hosts and the risk of subclinical cases. The study was conducted from March to September 2018 on a pair of red pandas and a breeding group of 19 meerkats. Both species are kept in open-top naturalistic enclosures and have access to indoor areas day and night. This is the meerkats outdoor enclosure. And the searching for lung parasites were tested with the Berman technique, and for each species they collected 8 pools of fecal samples on regular intervals of a 3-day period. And the sample tested positive for metastrongyloid. These are the larvae in the fecal samples of red pandas and meerkats. Was administered a convenient therapy described by domestic dogs. Oral fenbendazole 50 mg per kilo for both species, repeated daily until negative results, and spot-on therapy with imidacloprid and moxidectin for meerkats and for red pandas, repeated 3 times during this period. The preliminary results were very variable, and fecal tests were repeated every 20 days in both species. 6 consecutive positive results, and at the 7 pools with the quantity and motility of larvae drastically decreased, and at the 8 pools tested negative. And this is variable results, and then also in the next pools of feces. We therefore ask ourselves some questions on these variable results, and in literature there are no prevention protocols in red pandas. However, successes have been reported with meldimycin oxim at 11.5 milligram for 5 kilos. And were administered Milpro, meldimycin oxim, since March 2019, and still active. This therapy is still active every 3 weeks. The results after this therapy is very good because there were no positive results and 9 negative results, and the therapy is still in progress. And red pandas are in fact the mainly arboreal species, and this is why it's difficult to monitor their health and administer therapy, and establish a very good relationship with the keeper and the relationship of trust. And it was important the implementation of a positive reinforcement training program to administer the spot-on therapy and weight the subject day by day. This is a session of target training, the first of the second section. And this is a section of hand presentation for touching. And these were the first step to take the administration of the therapies and the spot-on therapies to touch the animal. But what's going on? The two species are still monitored via the Berman technique every month before the therapy, and fecal samples were sent to Teramo University to be analyzed with the PCR method for DNA identification and differentiation of the parasite species. And another goal is to building a training tunnel for meerkats for administering therapy without the capture. And literature lacks of papers concerning an effective therapy for both species. The applied therapy provided to be a useful tool for veterinary care and husbandry strategies, but we are not aware of drug residues in the tissue and side effects because there aren't many studies. And monitoring with Berman test, even in absence of respiratory symptoms, it's very important because there are a lot of subclinical cases without symptoms, and control program of the wild mammals and intermediate hosts are the two main methods of ensuring health in these species. Thanks.